Well, right now we have a guest from Hoag. Actually, it's Hoag, their urgent care their emergency care department over in Irvine. We have Dr. Sarah Cusick. Nice to meet you, sir. Welcome.
Good morning. It's a pleasure.
Nice to have you here today.
Thank you for having me.
So, you work out of Hoag Hospital, Irvine, in the emergency department. Am I right?
Correct, yes.
And is your role, are you like an attending physician? Do you oversee that department?
So first and foremost, I'm an emergency physician.
Okay.
And I've been with Hoag Irvine since its opening, maybe 6.5 years ago.
Okay.
And for the bulk of that time, I've served as the medical director. So that means that I oversee the care from a physician standpoint in concert with Melinda Jordan, our nursing director, and make sure the department's operating as efficient as it possibly can.
All right. What is basically the difference between an emergency room and urgent care? And do you operate both over there? There's an urgent care somewhere
an urgent
near.
care. We just opened one actually right across the street from us in the Shady Creek.
Yeah.
Absolutely. So emergency rooms and urgent cares probably have some overlap. There's a broad spectrum of both.
Right.
But in general, emergency departments have staffing, resources, and equipment to treat and stabilize life-threatening emergencies.
Right.
And they're staffed by, in our facilities, board-certified emergency physicians.
Okay.
And they're open continuously. Urgent cares may have different and limited access to certain diagnostics, labs or radiology, certain treatment limitations, and may have staffing that ranges from mid-level providers to physicians of different specialties.
So with an urgent care, that might be, it's later in the evening, and you realize that you don't need to call 911, but you could be coming down with a severe flu.
Sure.
Right? And you want to go in and get treated right away, or figure out, is this what's going on? And then maybe from there they can figure out, no, this is something not as serious or more serious.
Yeah.
Am I right?
That's a great way to identify the potential use for urgent care.
Okay.
You have common illnesses, headaches, sore throats, earaches, skin rashes, common injuries like strains and sprains and bruises and maybe early fractures, things like that. Great use of urgent cares. And if it's something that they aren't comfortable with or don't have resources for, they can always refer to the emergency room, and that can be a seamless transition in care.
Okay. And if I'm kind of correct, if you went back maybe 20, 30 years ago, there was no such thing as urgent care that I recall. It was
you
more
called your doctor and tried to get a same-day appointment.
Right,
that was the urgent care.
And then you'd pop up to the emergency room if you needed that. And these kind of filled that void.
They fill a very nice void, and they can provide very timely, efficient care for a number of conditions that don't need the resources or the staffing that emergency department provides.
All right. Now, over at your emergency department, you're generally going to get people that are coming in from a 911 call through ambulance. You work with the Orange County Fire Authority and the sheriffs and all that kind of stuff. Am I right?
Yeah, and we have a large percentage of walk-in patients as well who either don't have other resources or have the perception of a life-threatening emergency or do have that emergency.
Right.
So yeah, a combination of both means of traffic, absolutely.
And what are some of the common conditions that you're going to be treating at an emergency? I mean, obviously, heart attacks and everything. Right. This is the first point of entry quite often, am I right?
Yeah, so the majority of the patients that are in the hospital came through the emergency room.
Right.
That's one way to think of it. And it's the perceived emergency. So it's chest pains, abdominal pains, fear of stroke, unstable vital signs, fainting spells, things of that nature definitely belong in the emergency department.
Okay, and your emergency department is expanding over in Irvine?
That's true and wonderful. So when we opened 6+ years ago,
I can't believe it's been 6 years.
I know.
Yeah. Wow.
We're growing exponentially though. So we are now seeing more than double the number of patients we anticipated seeing upon opening. And our tiny little emergency room has been stressed because of that. So we've just started the preliminary construction on a modernization and expansion program that will give us more than twice the number of private rooms we have now, and the square footage will increase relatively much greater than that to accommodate modern care pathways and current codes. And we're hoping that's going to be completed in the next 2 to 3 years. So,
you know, I think a question people often have is, what emergency room am I going to be brought to? And is it affiliated with the hospital that is on my plan? How does that all work? If someone here in Laguna Woods needs emergency care, obviously there are a lot of hospitals around here. how do they know which one to go get to? Are you guys kind of in a rotation? How does that work?
So it's not rotation. It's somewhat based upon the paramedic's assessment of the patient
Okay.
and the need for the services they anticipate, because every hospital has different levels of service they can offer, whether it be trauma or cardiac or stroke.
Okay.
And then within that, there's always the option for patient preference, should the paramedic feel that that's safe.
Okay.
So if they wish to go to a Hoag hospital, they can always request that if it doesn't require a service that Hoag does not offer. For example, we're not a trauma center. So if it's a major trauma, they're going to need to go to a different facility.
Okay.
But otherwise, the paramedic will take them to the nearest paramedic receiving center that's appropriate and by patient preference.
Okay. Now, if they are not able to have a preference and they go to your hospital or another one, does that matter as far as, most people in this community are probably on Medicare or other some kind of thing. Does that matter? A lot of people's concerns might be, their
gonna
first
get covered,
concern is
right.
not about, they're going to help me out. It's like, how am I going to pay for this?
Yeah. Everyone's concerned nowadays with health.
Yeah.
But absolutely, emergency physicians treat and stabilize all conditions across all insurances.
Okay.
No assurance that's out of network, that has no bearing upon the emergency department care.
Okay.
If the patient requires admission and has a specific insurance that has a very narrow network and the patient is stabilized, the patient could be transferred thereafter.
Okay.
But emergency care can be provided to patients of all insurance types.
Okay. So you oversee the department, am I
Correct.
right?
Yeah.
And how many people do you have on staff there? It's 24 hours, I would assume.
We're open all the time. We have continuous presence of a board-certified emergency physician. We also have mid-level providers, PAs, and nurse practitioners who've devoted their career to practicing within the emergency department. And we have nurses round the clock that are specialized emergency nurses.
Okay.
And the numbers vary based on time of day and time of the year, based on volumes.
Okay.
But there's always those three components of the care team.
Okay. And again, you've been over there for six and a half years.
Yeah.
Where were you before? Were you with Hoag somewhere else? Or?
I was not. I came to Hoag from the academic world. I was,
Oh, really?
I was faculty at UC Davis Medical Center and taught residents and students how to become emergency
Wow.
physicians.
Very nice.
So yeah, nice to be with Hoag for sure.
Yeah, that's a nice place up there in
Not
Davis,
bad.
right? Yeah. Well, Doctor, it's a pleasure meeting you.
It's been nice talking with you.
And I want to tell people that if for some reason you need to call Hoag, just 800-400-HOAG, right there, very easy. And, we hope you don't need an emergency department, but if you do, rest assured that Hoag is just right up the way, and this fine doctor and his staff will be there helping you all they can.
Thank you so much.
Great to meet you.
Great to meet you.
We'll be right back.